Thank you, Melissa. Good afternoon, everybody. My name is Ajay Kumar. I'm Chief Clinical Officer for Hartford HealthCare. I'd like to welcome you to this media briefing. This is a milestone today, monumental day today for achieving a milestone by Pfizer vaccines to get full approval of FDA. And we thought we'll just talk about what does it mean to us and what does it mean for society at this time here. The FDA has always been very rigorous in their analysis and how they evaluate the vaccines. The EUA really helped us galvanize millions of vaccines across the world. And I like to believe a lot of lives were saved as well because of that initiative. Now, this FDA approval today solidifies one more milestone towards the journey of creating a safer society with the COVID pandemic. I'm very excited actually that the FDA has approved it in August, and we thought it's going to take some more time, but I'm glad that they were able to get the arms around to all the data and scientific evidence and gave a full approval to that. So for what it means to all of us right now is that individuals who are still on the fence to get the vaccine hopefully can get a fresh or better reassurance about the vaccines as we go forward, especially by the Pfizer, and I would say for Moderna as well. For Pfizer right now, I think there is a good place for us to be to convince our members actually who may not be quite ready for the vaccination at this time. You know, Hartford HealthCare continues to see the numbers of many of the COVID patients coming to the hospital right now. We're largely managing unvaccinated people in our critical care and our floors as well at this time. As of this morning, we have 117 patients who are COVID positive. If I could go back to early July, we had just about 10 or 12 patients at that time here. So certainly in 2 months, we've seen a significant incline right now. And if you can follow what happened in the United Kingdom, we are following them 2 to 4 weeks after their peak. So we are seeing the peak coming up at this time with number of hospitalization. 74% of these people actually who are in the hospital with COVID are unvaccinated. Generally younger individuals who have some comorbidities, but there's a significant risk of mortality and suffering on those patients here. So with this new FDA approval, I'm hoping that the rest of the community who's not vaccinated will seek vaccination at this time. So I'll stop here for any questions, comments, or any discussions around that.
Please feel free to raise your hand or put it in the chat if you have any questions. We have a question. What do you think was the delay with the approval?
Sierra, I would say I would not classify as a delay. I would classify as a timing issues. Generally, FDA takes more than 2 years to approve these kind of vaccinations. I think they've done an expedited process in many ways. The challenge we've had, this vaccine, which is given to millions and millions of people across the world, has been highly scrutinized and much awaited, and tremendous data has been collected and transparently shared across the world. We, from the scientific community or the medical community, felt it could have been done earlier on, and FDA has reacted to that accordingly. It's essentially going through a lot of data, a lot of information, a lot of studies, and the scientific advisory committee has to make sense of all of them to provide the best evidence to the community and to society. So it seems like a delay given millions of vaccines were given, but from FDA timeframe, it's actually pretty early at the moment on the FDA approval. But it is essentially going through a lot of studies and data. It's just a laborious project to evaluate.
We have another question from Erica. She asked, do you have a sense of when the Moderna vaccine might get full FDA approval?
Erica, I don't know for sure. I know Moderna has submitted an approval request as well. Our initial thinking was that the Pfizer approval will happen sometime in September. It's happening in August now. I would imagine in end of September or October, we will hear more details about Moderna and probably some sort of an approval around that time frame.
Are there any other questions that anybody has for Ajay at this time.
I have a question real quick, if you don't mind.
Go ahead. Yes.
So I know a lot of people have said that FDA approval was one of the things that they were waiting for in deciding to get vaccinated, but I'm wondering to what extent you think that people actually follow through on that, and to what extent that was they'll just kind of maybe, I don't know, find a different reason if they're not inclined to get vaccinated.
Yeah, Alex, I suppose that many of the individuals are waiting for the FDA approval, and I think they're going to be much more reassured now since the approval has been given. There could be a small segment of individuals who are finding, I would say, reasons why not to get the vaccines, and I'm hoping they're closer to making a decision about, especially after FDA approval. So I believe in the goodness of people, and I would imagine that the people will follow through on the FDA approval piece and seek vaccination at this time.
Ajay, we had another question.
Yeah.
It said, any idea when we could see full FDA approval for 12 to 15-year-olds?
I actually don't know. That's the honest answer. I think we'll come to know hopefully next several weeks. I know the studies are not quite finally submitted for full approval, so it takes some time. So I don't know when that would be.
A question too, if I could just jump in. What do you think the impact of this approval will be on the issue of vaccine mandates, both in Connecticut and across the country?
I think that should help, especially with the vaccine mandate. We were in Connecticut have felt the same thing. Our colleagues who actually have not been vaccinated have asked the same question. Look, I'll be comfortable when it's been approved by FDA. So I'm hoping it's going to have positive impact. It's going to assist many of the private companies and other institutions who have mandated to get to the goals of mandating vaccines for all the workers and colleagues.
Is there anybody else that has any questions? Ajay, do you have any final thoughts you want to share before we go?
Yeah, I think I can share the numbers of Hartford HealthCare in terms of number of patients we have with COVID at this time, if that might be of help to some of the individuals. We have 16 patients in Bacchus Hospital. Charlotte Hungerford has 7 patients today. Hartford Hospital has the largest number, 42 patients who are COVID. Midsted Medical Center has 14 patients. St. Vincent has 7 patients. Hospital Center Connecticut has 26 patients. And Wyndham Hospital has 5 patients. Out of all the COVID patients who are in the hospital, 20 of them are in ICU today. And there are 13 of them are requiring ventilation support and 7 are not. Largely, almost, I think everybody is unvaccinated who's in ICU at this time.
Dr. Kumar, you guys had talked about anticipating a plateau in the number of cases or hospitalizations, or even that beginning to go down. What's the latest on that? Have you begun to see that?
We have not actually, Alex. I must admit the last week when I was looking at the number, I had thought we had reached a plateau, but last several days we've seen it somewhat increase at this time. Interestingly, Alex, what we are seeing here is that it's unvaccinated ones who are generally coming in, but the breakthrough infections are happening in individuals who are elderly, who have immunocompromised status and other things as well. So I'm hoping the booster push will help contain that increase in rise at the moment. On the positive note is that we are seeing the people who are vaccinated are making a good recovery. And generally they're not, the mortality is lower in those patients or hardly existent. There's hardly any mortality at this time. So that's a positive. But unfortunately, we have not seen the plateau yet.
Thanks.
You're welcome.
Okay, it doesn't look like we have any other questions at this time. So we thank you for joining us today. Oh, somebody's just joining. But any information you can find on our website, hartfordhealthcare.org/vaccine. Thank you for joining us today. Thank you, Ajay.
Thank you, everybody.